WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 5 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
It is a Wellness Wednesday. Thanks for joining us on WAJR AM in Morgantown and on the AJR News Network. Wellness Wednesday, sponsored by Fairmont Regional Medical Center. And our guest today is Dr. David Tingler. He's been with us before. He's a board-certified cardiologist who's been in practice at Fairmont Regional Medical Center since 2009, and we can get into a little bit more of his personal background as we move along here. But Dr. Tingler, good morning. Thanks for coming in.
Hey, good morning. Great to be back.
We're here to talk about heart health, and obviously always something that everyone should pay attention to. But one of the things we're going to focus on today is the palpitations, irregular heartbeats. And some people may have this and think it is it's not very important or insignificant, and perhaps it is, but when should they take action when you feel those heart palpitations or when you have your heart skip a beat a little bit? Let's start there. Describe those symptoms and what might be going on when people feel those symptoms.
Absolutely. Palpitations is one of the most common things that we as cardiologists see on a daily basis. I don't think a day goes by when we don't see a patient having palpitations as one of their chief complaints or main worries. And so the question becomes, when should you be worried, and when is it something that you should seek medical attention for right away? Some of the most worrisome things would be obviously passing out or associated symptoms such as chest pain, really short of breath, symptoms that don't go away on their own. Those are the most worrisome symptoms that certainly need to be looked into further.
Mm-hmm. Sometimes when you have, obviously, if you have the chest pain and the shortness of breath, that could be an indication that you're having some sort of episode, maybe a heart attack. But with the palpitations, again, some of these occur, they're minor, but you don't get a lot of the more serious symptoms, right?
Yeah, palpitations is, again, very common, and I've read thousands of heart monitors where a patient will wear a monitor for 24 hours, and almost without fail, everybody has a skip beat, okay? And so it's a question of how often do you have them, and do you feel them, and what types of skip beats are they? So they're very common. Excess caffeine, stress, lack of rest, these are three of the most common things that can produce palpitations, and they're often benign, but they can certainly be much more serious, and again, it depends on the associated symptoms that go along with them. So that determines whether you should get further medical attention.
All right, so what's going on when your heart skips a beat or when you have a palpitation?
Well, there's a variety of things that could be going on. Most of the time, again, they're benign. There's a kind of a skip beat or an extra beat. Patients will describe everything from my heart fluttering in my chest, like a wash machine out of rhythm, just fast heartbeats. So palpitations is a symptom that can be different to every patient. So when that's happening, it can be, again, just fast heart rates, whether you've ran up a flight of stairs or you've had too much caffeine or your heart's out of rhythm, or it could be skip beats, extra beats. Instead of the heart beating in a nice synchronous rhythm, you can get extra beats, and those are felt as palpitations is the classic description.
Dr. David Tingler is with us, cardiologist from Fairmont Regional Medical Center, and you can join us if you have a question or a symptom. Obviously, he can't diagnose you over the radio, but obviously he's got knowledge. So if you have a question, give us a call, 296-0041, 800-765-8255. Okay, so when do we cross over from a palpitation or a skipped heartbeat being benign into something that's more serious that you need to worry about?
Again, the associated symptoms are the most important things. Number one thing would be passing out. That's something we take very serious. So when I see somebody with palpitations, that's always one of the questions I'm going to ask them. Have you ever passed out, especially with the palpitations? And then again, the other symptoms of chest discomfort or pain and shortness of breath. Those are the kind of the three biggest things: passing out, chest discomfort, and shortness of breath. And then beyond that, it's symptoms that are affecting your daily life that are so bothersome that they're making you worried and causing anxiety. And those are the things that often bring patients to my office for further evaluation.
If you have a palpitation or you have a heart that's out of rhythm, but it's not a major problem, what types of things do you do to treat that? Some people just live with it and just kind of go on and take pause when it happens, and then they're okay. But what sort of treatments are there for that?
And again, it goes into a lot of the details of what's causing the palpitations, what type of heart arrhythmias, if you're having one, is present. And so oftentimes I see a patient with palpitations and they have a few skip beats on a monitor, and oftentimes we can reassure them that they're benign and nothing needs to be done. Maybe cut down on caffeine, get more rest, and cut down on stress. Those are the simple, most conservative things. However, most of the patients, by the time they get to my office, have some other serious issue, blood pressure, heart blockages, and so occasionally it leads to medical therapy, meaning medicines that can slow down your heart rate and prevent or treat the palpitations. Or the most aggressive thing would be an invasive heart procedure, which could possibly map out the electrical system of the heart and even be treated with what's called an ablation.
Mm-hmm. In terms of you talk about the heart monitor. You keep mentioning a heart monitor. So if someone is having these symptoms, they can see their cardiologist. They wear a heart monitor for a period of time, and what does that do? What type of information does that provide to you as a physician?
So 3 major ways that I can evaluate palpitations is a simple EKG. That's something that takes 5 seconds to do, and it can occasionally pick up skip beats just on that short amount of time. More often, it takes being on a monitor, either in a hospital or wearing a 24-hour heart monitor, often referred to as a Holter monitor. And what it does, it shows every single heartbeat for the entire 24 hours. Patients often given a diary or a log to write down symptoms, time of day, what they're doing, what type of activity, so that we can correlate that when we interpret the monitor. The third way to evaluate them is a event monitor, where you wear a monitor for an entire month.
Mm-hmm.
You can take it off to shower, but most of the time you wear it pretty much 24/7, and those are for the ones that are more difficult to catch. They're not having them every day. I have them once or twice a week, so a 24-hour monitor may miss the symptoms or not really show what's going on. So occasionally we got to go further to a 30-day event monitor to pick up the palpitation.
The event monitor, so when that occurs, you activate that event monitor and it gets a reading, and that information
that's the major difference. The 24-hour records everything, no matter what you do.
Right.
The event monitor is more triggered by the patient. If you have a symptom, you push the button and it records that time of day and what your heart's doing at that moment in time.
How common is this? You say pretty much everybody during the course of a day or a week or a month is their heart's gonna skip a beat or palpitate slightly. How common is it when someone has to seek medical attention for something like that?
Again, being one of the most common things that I see, arrhythmias or palpitations are almost ubiquitous within the population. Everybody has a skip beat, almost without fail. The question is, when is it serious enough to seek medical attention? And most people have skip beats and they either don't acknowledge them or feel them or know what it is. And most of the people, when I start quizzing them, asking them questions about their palpitations, they'll often notice them more at night. When you lay down in bed, you're lying quietly in bed and you feel these, whereas on the monitor, it may show they're having them all day, but they only feel them at those times. But that brings up another important point, is if they have them with activity, that's actually more of a worrisome sign. If you're under a lot of stress and you're laying in bed at night and you feel your heart skip a beat, that's often fairly benign. But if you have them with going upstairs or simple household chores, those types of palpitations can be somewhat more worrisome.
Mm-hmm. All right, so that's the time perhaps to step in and see your physician, see a cardiologist. Dr. Tingler is with us again with Fairmont Regional Medical Center, has been there since 2009, completed an internal medicine residency and cardiology fellowship at WVU, board certified in internal medicine, cardiology, and nuclear cardiology. So obviously you've been at this a while. How has it changed in terms of treatment, or has it changed? Is cardiology and the treatment of heart, the muscle itself, has it evolved and changed since you've been at this?
Well, over the past decade, there's not been huge changes. However, there have been some certain advances. Again, the monitoring, the way we discover these, has really remained unchanged.
Mm-hmm.
The medications are largely, again, unchanged. There's been a few new medicines along the way. What has changed is newer procedures to actually treat or cure the palpitations. Ablation has been around for years, but some of the tougher arrhythmias, such as atrial fibrillation, we are constantly evolving new and more advanced technologies to more effectively potentially cure these arrhythmias, whereas in the past the success rate wasn't that great, and so it's kind of a last resort. Now we're pushing earlier to send patients for potential curative therapies, whereas in the past we tried medicines for years, and once that failed, we ultimately try to not so successful procedure. So it's really exciting time for patients who have very serious palpitations or arrhythmias.
I know everyone's different, but I would think most people would, given the choice between taking a medication every single day for the rest of your life or having an ablation or some other procedure to correct what is wrong, they would probably choose that.
And it's so varied from patient to patient.
Yeah.
So if I see a 20 or 30-year-old, which in my practice is a very young patient, with palpitations that are bothersome, it's great if I can reassure them and say, this is not going to necessarily kill you or cause major problems, and sometimes that's a tough sell.
But it's a nuisance.
It is, and so again, if I have a 30-year-old who you're committing to potentially decades of medical therapy, those people sometimes it's easier to sell them, if you will, on maybe a procedure that could cure this and avoid having long-term medical therapy. However, invasive procedures have their own inherent risks and costs, these sort of things. So each patient has their preferences as to where they would rather treat this with medicines or invasive therapies. And again, at the extremes of age, 80, 90-year-old patients, those often we very much try to treat medically first, if at all possible, to avoid potentially invasive and complicated procedures.
What do you have to do to keep up with the latest? Are there journals? Are there conferences you have to go to? I would imagine you get together as a group and talk things over. What's it take for a doctor to keep up with the very latest in these procedures and treatments?
It is a daily challenge for sure. I mean, it's continually evolving, and a couple of things we do. There's national meetings each year, the American Heart Association, the American College of Cardiology, national meetings at least once a year, as well as several other smaller meetings that kind of get the best minds in the world, if you will, together and go over all the latest research and new treatment therapies and procedures. And so that's kind of the major events of the year. However, on a daily basis, there's continual journals, news articles, forums, and blogs, and these sort of things. So it's a challenge to keep up with all the latest things, but it's also a reason it's an exciting field, because it's never stagnant, and it changes almost on a daily basis.
We are with Dr. David Tingler, a board-certified cardiologist. He's been at practice at Fairmont Regional Medical Center since 2009. We're talking heart health, and we'll talk a little bit about preventative measures when we return. Stay with us. This is Ask the Experts Wellness Wednesday, sponsored by Fairmont Regional Medical Center. We'll continue after this.
WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 5 years in a row as a top performer by the Joint Commission.
We are back on Wellness Wednesday. Fairmont Regional Medical Center, the sponsor of this program, Wellness Wednesday, and Dr. David Tingler is with us, board-certified cardiologist with Fairmont Regional Medical Center. And we talked a lot in that first segment about palpitations and skipped heartbeats, and some situations are more serious than others. But let's talk a moment here about, we talked about awareness. Let's talk about preventing these things and heart health. Just start there. What people can do to avoid some of these situations.
Okay, well, this is an important time to be doing this, because American Heart Association, this is February's Go Red for Heart Health Month. So it's a month where the American Heart Association specifically has designated for increased heart awareness. And so one of the best things for patients to do is be aware of what are the risk factors for heart disease. Again, palpitations is a single category, but overall, just heart health in general, knowing your risk factors is quite important. So some of the major things that when we see patients in the office that we're looking for as risk factors, number one is high blood pressure. Very, very common. Almost everybody I see has either high blood pressure or borderline high blood pressure. Cholesterol levels or high cholesterol is another important risk factor. Diabetes, unfortunately, is very, very prominent in our state, and it's a big risk factor for heart disease. Certainly being overweight, smoking, physical inactivity. And then if you've ever had any other previous heart problems or stroke, these are some things that are just ubiquitous with heart disease. So knowing those risk factors or knowing your numbers, for example, if you don't go to a physician regularly or you don't know your numbers, just starting off with simple knowing your blood pressure, knowing your blood sugar, knowing your cholesterol levels. Those three things are a great start just to kind of get a baseline for what is your risk for developing heart disease either right away or down the road.
Mm-hmm. And there are plenty of places that you can get those numbers. There's health fairs. A lot of employees, a lot of employers sponsor health days where you can come in and get your blood checked and get your blood pressure checked. So it's not necessarily something that's going to cost you a lot of money, and that's just some basic information that you need.
Absolutely. Most family practitioners, your general practitioners, are doing these things as part of their routine, physician-patient screening to begin with. However, I know several local hospitals offer health fairs. Again, like you say, most employers will offer low-cost health screening, and then even most hospitals have very low-cost general blood lab screening for general cholesterol and glucose or sugar level. So it can be done at a very low cost for most patients.
You talk about those risk factors, and a lot of them are very simple. Don't smoke. Stop smoke. If you smoke, stop. Don't start. And your diet. I mean, those are very simple things that affect everything, but probably most importantly, your heart.
Yeah, absolutely. I mean, there's several what we call modifiable risk factors. These things that you have control over and you can change, such as your blood pressure. It can be treated. If you're overweight, you can work with your physician to get on a health program to lose weight. You can control your cholesterol. You can control your sugar levels. Again, number one modifiable risk factor is obviously smoking. If you smoke, cut down obviously, but ideally quit. And then there's the non-modifiable risk factors. If you're over age 50, if you have a strong family history, these things you obviously can't change, but again, are important to know when you see a physician, to let them know that you have those risk factors so that they can further risk stratify you and determine what your chances of having heart problems.
Difference between men and women in terms of heart health. Is there much? Obviously, a lot of those risk factors are the same, but are there some things that women may have to look out for?
Yeah, it's often thought of as a male or men's disease, heart disease, and so it's a common myth in the medical world that women have less heart disease than men, but it's really far from the truth. About half the heart attacks and half the deaths from heart disease are in women. Interesting statistic that I came across women between ages 40 and 60 are actually more likely to die from heart disease than they are breast cancer, and so breast cancer gets a lot of press and it's very important in women's health, but I think heart disease sometimes is not thought of as being as important in women's health, but it is very common. And important distinction is the symptoms. Men often have the classic, elephant on my chest, pressure, severe pain like you see in the movies. And women often present the same way. However, they're much more likely to have what we call atypical symptoms. They have generalized fatigue, overwhelming fatigue, shortness of breath, maybe pain in their back or their jaw, and may not have chest pain or pressure at all. I've tried to, over the years, gotten away from even asking about chest pain because I have patients who are clutching their chest and will just absolutely refuse that it's pain. And it's interesting how people will describe, a discomfort, a pressure, a heaviness. So you have to be somewhat, clever in how you ask patients these types of symptoms.
All right. Well, Dr. Tingler's been our guest, Dr. David Tingler, and you're going to come back in a couple of weeks, right?
Yes, sir.
So we're going to expand on this a little bit in terms of heart health and some of the treatments. You've been listening to Wellness Wednesday, a program sponsored by Fairmont Regional Medical Center, and you can reach the facility, the general number 304-367-7100. Thanks for coming in. We'll see you in a few weeks.
All right. Thanks for having me.
That's Wellness Wednesday on WAJR and the AJR News Network.
You didn't see this coming. This was not your fault. A car wreck changed everything, but you've got the advantage. And Gotti and Stratton